I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Today is the next to the last in our presentations on COVID-19. We've been doing a series of noon town hall meetings since almost the beginning of December, and the schedule goes through tomorrow, the 31st. Thanks to the Minnesota Department of Health for underwriting this special series of town hall meetings. We've had a lot of fun and a lot of learning in the course of some, I think, almost 30 interviews with leaders, elders, politicians, business owners, artists, organizers in our community about how our community is responding to the COVID-19 pandemic. As often as not, our conversations have included the impact of the confluence of the COVID-19 pandemic and the what we call the 1619 pandemic, that obviously referring to the historic uh, uh, racism, racial injustice emanating out of the enslavement of African people in this country and its predecessor, the colonial experience here. So we talk about that, and it's an important conversation. I'm pleased to have my colleague, Brenda Lyle Gray, who is co-hosting this series with me. Brenda, good morning.
Morning.
Good afternoon. Thanks for being here. I'm going to sneeze. Hold on. Sorry. Okay. And today we're going to have a great conversation with Kimberly Spates. She's North Point's Chief Operations Officer. And you've often heard me talk about North Point Health and Wellness. It's a legacy institution, probably one of several in the country remaining, that grew out of the Great Society initiative of President Lyndon Johnson in the 60s. And North Point has evolved and continually reinvented itself and stands as a testament to what community engagement, what civic engagement, what directing uh, and serving the needs of the community, what that really means. Well, Kimberly Spates is the Chief Operations Officer of North Point. It used to be called Pilot City, but as the Chief Operations Officer, she provides the overall management of the Human and Social Services Division for North Point Health and Wellness Center Incorporated. Her duties include budget development and control, monthly, quarterly, fiscal, and year-end and other reports and financial statements, records, statistical reports, etc., as needed. She supervises and evaluates the agency's program staff and operations through direct observation and analysis of department performance. She ensures that departments achieve their stated goals and objectives, and she also plans and implements program objectives along with the development of innovative tools to measure program results in accordance with the organizational goals and objectives. She's had over 20 years of experience working in the public sector, areas of housing, education, social and human services. She has a master's degree in public administration, nonprofit management from Metropolitan State University, and a bachelor's degree from Texas A&M in political science. Kimberly, thank you. If I can call you Kimberly, thank you so much for being here. And it's a pleasure to have this conversation with you on the program today. And I'm not hearing you.
Thank you.
There we
I
go.
appreciate being here.
Okay, great.
Oh, can you
Well,
hear me now?
I do perfectly, and thank you
Okay.
so much. Let's do this. Let's
Okay.
give
Better.
people a North Point 101 again. I've described a little bit about the
Okay.
legacy, but it's always good to hear it from somebody who's actually in the driver's seat, as you are right now. So, talk about what you tell people about the mission, vision, and work of North Point Health and Wellness.
Thank you, Mr. McFarlane. I really appreciate the opportunity to be with you all today. Hello, Twin Cities. North Point Health and Wellness Center really is a public-private partnership with the community to provide both uh, primary care, behavioral health, dental, as well as human and social services. I think the way I like to talk about Pilot City / North Point is that if there's a question that you have or you looking for some help, North Point is the place to come. We may not have what you need, but we know how to get it and we know how to get you connected. I think we live out our mission around partnering to create a healthier community every day, and our ability to connect with other organizations, other institutions to bring information and connection for the community. So while we have a large number of services here, we might not have everything, but we know who does and we know how to get you connected. So I think that's the exciting part for me about working here, is that it really is community focused. And we pride ourselves in being able to say, well, I may not know, but I know somebody who does. And that's what happens in our community anyway, right? It's Miss Smith down the hallway. It's Mr. Brown down the street who can fix the car, and we have that all like in one place, and makes it easier for people to navigate systems that can be very difficult, and also just feel connected to what they know, and their community. So that's how I would describe it.
Well, let me add to that one thing you didn't say, but I'm glad to say and pleased to say, and I speak with authority as an observer and a resident of the community for the entire time that North Point Pilot City has been around. What you have is a phenomenal reputation for integrity. Your organization and your staff uh, really bring, um, they epitomize, they are the gold standard of integrity in maintaining patient confidentiality, in maintaining confidence in the community for the services that people and their families, and families receive. And so I think for that alone, this is among many of the attributes that deserve praise. That's a very important one. People trust. People really, really, really trust North Point Health and Wellness, not only on the medical and dental side, but also on the social services side. And as you described, it's like breathing. This is what you do. You go ask, and
Yeah.
if the person doesn't have the specific answer, they find the answer for you. You're not left abandoned, lost, confused. You are guided, shepherded towards the answers that you seek. So, congratulations to. I just want to say that because I think people need to know that you need to know that people hold you in the highest esteem, and I think it's important to say it. Yeah. And so the
Thank
question
you.
now is
Appreciate that.
how institutions navigate and pivot to respond to COVID-19. Oh, you know what? I got to disclose something too.
Mhm.
Uh, all that praise,
Mhm.
I have a vested interest. One of my daughters works there. So, so um,
Oh, okay.
my
Okay.
daughter
Great.
Michelle
That's good.
Michelle Wells is one of your managers, and
Oh, yes.
runs
Uh-huh.
your call center.
Yes.
So uh, I don't mind
Yes.
bragging about my daughter, number one, but it's fair for me to tell
Yes.
the viewers that I've got an interest here too, and that's my own family interest with my daughter working there, and I'm glad she's there, and she's glad to be there as
Yes.
well.
I'm glad. Yeah, I'm glad she's here too. She makes sure people get to where they're supposed to be and follows up. And she has some of your good tendencies around keeping people in order and making sure they do what they're supposed to do. So I appreciate that. It's wonderful working with her. So thank you.
And so, COVID-19, what has been the organization's role in responding to uh, COVID-19 here in North Minneapolis?
Yeah. So our major role has been really around testing. We provided drive-up testing in the spring and summer and into the fall. I think that was a big help. We were getting folks from all across the Twin Cities coming to get the service just because they could drive in. It was convenient. But we also do it in a culturally responsive and community-focused way and manner. I think also, North Point has been at the tables where decisions are being made about where should these testing sites be, who should be providing the testing. So we've been at the tables to kind of guide decisions that are being made both at the county and state level. As North Point is a federally qualified healthcare center, all they come together with the Minnesota. I know I'm going to get this wrong, but the Minnesota Community Health uh, MINAC is the acronym.
Hmm.
I don't remember what it all says, but coming together with them because we all focus on populations that have high health disparities, and so because of the impact that COVID has had on individuals who have comorbidities and other health conditions, we are seen as a leader in deciding who gets vaccine when, where testing should be. But we also had to pivot as far as the services that we provide, right? We provide basic services like food, access to rental assistance, making sure people can still get health and medical services as they need them. And so we've created these teams of individuals who have worked very closely together across both of our organizations at the clinic and in human services to ensure that we can continue to provide services. So we've made adjustments at our food shelf to pre-pack food. As y'all may have seen during the summer, we did drive-through food distributions just so individuals could get food in a safe and healthy way. We've also ensured that we have ability to screen individuals when they come into the building. And we've shifted a lot of our services to telehealth. So our behavioral health department has done phenomenal work in being able to still provide support to individuals who may be struggling with mental health. As COVID in 2020 has been a drain on everyone's mental health. The ability to still connect via Zoom or the phone has been a big help. They've seen a large increase in individuals showing up for their appointments, but also seeking help. And so we've been able to do some things in the community that we normally wouldn't be able to do with our drive-up clinics and things like that, this flexibility. So we've seen it both as a gift and a curse, right? We see people being impacted, by getting ill and family members being ill, kids being at home, but we've also been able to deliver services in a different fashion that may be able to get to people quicker and also still provide that same level of service.
That's great. I've pulled up
that we would do in person.
a copy of the Hennepin County report. I had Commissioner Jan Malcolm on yesterday. I think it was yesterday, the day before yesterday. Great conversation with her. And then I've had officials from Hennepin County. And, your program, North Point, is essentially a Hennepin County affiliated program. And I want to ask you to, and if it's not a fair question, you tell me it's okay, to walk me through the data that I'm going to put up. And the data is from the Hennepin County website, the dashboard. And, my intent, Kimberly, is to try to do this as often as I can, daily or weekly or whatever I need to do. And in the paper, talk about the numbers, the data. And I appreciate you're a data person, I think. That's what your specialty is. So hopefully this will be a conversation that both you and I will think is beneficial to our community. And so what I'm pulling up, I'll go back to page 1. First of all, the county, Hennepin County, has this dashboard that gives the current situation, COVID-19 in Hennepin, and you can also find for Minnesota. And first window there is the 14-day case rate. It kind of shows you the trend over 14 days, gives you the total number of cases in Hennepin County, including hospitalizations and cases resulting in death. Compares that with Minnesota in general. And I think it's fair to say that Hennepin County is one of the larger areas impacted, right? Because it's a large population center. Is that a fair statement to make,
That's
Kimberly?
good.
Okay. And then I go
That's,
to, go
that's
ahead.
fair.
Comment as you want to on this. I go to page 2.
Oh no, I am a data person. Okay.
Okay. Page 2 shows a trend.
Go ahead.
Talk about this trend. What is it?
Mm-hmm.
How does the average consumer interpret this data? So I'm gonna have you do some teaching and showing.
Yeah. I'm gonna try really hard. I do data, but this is not my data. This is not my strong suit. But I will try very hard to do. I think this shows the new positive cases in the last on a 2-week average, and so as you can see up in the earlier parts of November, we had a high rate of positive new cases, and now we're seeing a decline in those cases. And I think some of that relates to It can be correlated back to the governor's shutdown, partial shutdown again,
Mhm.
and heightened awareness of wearing a mask, social distancing, getting tested. I think people have been a little fatigued, but you can see that over the October, November when it was red alert, because we were seeing, more folks just being infected because of a number of reasons, right? It was mostly community spread, and so you don't really know where it's coming from when it's in the community, right? You could have got it at the grocery store,
Right.
could have got it from your neighbor who you talked to, and so this kind of exerted additional, what's the right word? Focus on wearing your mask, ensuring that you're being socially distant for this shorter period of time. Now you're seeing the effects of us staying consistent with that.
So let me go through what I heard when the officer from Hennepin County was on the
Mhm.
program explaining this chart. I'm going to sort of say what I heard her tell me, and you
Mhm.
can critique me to see if my understanding is right, as far as you can tell, because I want to be, transparent. I'm not a data person. I'm a journalist. I'm a reporter, and
Good.
so. Uh, but I think it's all about presenting the information to our people and getting our people, our
Yeah.
community, used to looking at the data, because
Right.
that's how we move ahead, by measuring. So this first figure talks about the total number of positive cases in Hennepin County, 43,929, and of that, uh,
Mhm.
of whites. That's number one, whites, and then blacks. Uh, uh, the number is 14,227, and then there are corresponding numbers for Asian, for Hispanic, people multiple, and unknown at the bottom there. Then it goes to hospitalization. So the raw number of whites hospitalized, 2499, and the raw number of deaths of white people, 1,036. For black people, out of 14,000 positive cases, hospitalizations, 1,399. That's almost 10%, I think, versus what
Right.
2,000 represents of 40,000. So there's a huge difference there, which we'll come to. And then for deaths, out of 14,000, 174 documented deaths of black people. I'm thinking a lot of that activity for black people is probably in North Minneapolis and South Minneapolis, but I don't know that. So, it's speculation on my part. But when you jump across the chart to the age adjusted rates, you look at the data in terms of cases per 100,000, and that's where the picture becomes real clear, and alarmingly so for our people, because out of 100,000 per 100,000 white people, there are 126 cases of you know infections, but for per 100,000 of black people, uh, there's almost 10,000. So it's double impact of black people. Scroll down two more columns, almost 14,000 Latinos, triple what it is for whites. And what I had understood, Kimberly, was that you all have discovered and talked about the overpresence of black and brown
Right.
in North Minneapolis, Hennepin County, and this bears that out. So this is a real thing,
Mm-hmm.
and why it's important is that I believe our public has to understand how much more at risk we are and what the actual real consequence of being at risk is. And this tells you that for black people, the risk is, the numbers say, double in terms of the exposure, 5,000 per 100,000, almost 9,200 per 100,000 for black people, and almost 14,000 for Latino brown people. And then you go to hospitalizations, the same thing. Whereas you have 178,000 uh, uh, per 100,000, 178 per 100,000 of whites, you have almost 1,000. So it's almost 9 times as many or 10 times as many
Mhm.
hospitalizations for black people, and more than that for Hispanic and people that identify as multiple races, and for American Indians, even higher. And then finally, the question of deaths. Uh, uh, on a per 100,000 basis, 58 per 100,000 of white people,
Mhm.
but 153 for black people. 3 times as many blacks die. Serious. For Latinos, almost the same, not quite as many.
Mhm.
But people that are multiple race, it's higher. So those people are likely, black and Indian, black and Latino, could be black and white, could be Asian. And for Native Americans, uh, yeah, you see it's 318 deaths. So those are alarming and sobering
Mhm.
statistics. So how should we as community be ingesting, interpreting, and responding to data like this? What do you think? And yeah, what are your thoughts?
Yeah, so I think what I've kind of come to understand and learn during this process is that COVID has kind of shown a really clear light on the disparities that happen in the Black and Brown communities that have been happening for a long time.
Mm-hmm.
Diabetes, hypertension, obesity. And now with this onset of COVID, you're seeing the picture like really clear. Like these numbers that you showed, it's clear. Like you can't get around it. It's not something that's over here that doesn't really affect me, because now it's affecting Black and Brown families on a rate that you can't like get around. Like 300 plus thousand deaths U.S. wide from a virus
Mm-hmm.
that could have been prevented, and and all these things. So what I try to tell our folks in our community is that this is the time to ensure that you are following all of the guidelines that need to be followed, right? When we talk about, eating a good diet, exercising, wear your mask, right? Wear your mask is going to be a little bit easier than doing that walk in the cold now, or, you know, making sure you're getting all the vegetables you can get, because now I lost my job. I might not be able to buy those. So ensuring that you see the numbers, that's very clear, but understanding that impact to you and your family. My daughter is 15. She doesn't always like to wear the mask.
Mm-hmm.
And sometimes when we go out, she looks at other people like, why don't they have their mask on? I said, we're Black. We have to wear a mask just because we're Black at
Right.
the end of the day. So regardless of whatever else is happening,
Mm-hmm.
for people of color, this is our ability to just preserve ourselves. We have to take those steps, regardless if we like it or not. And hopefully that'll begin to really say, okay, now what are we going to do different in this healthcare system and our educational system, whatever, because all of these things, social determinants of health are all connected,
Mm-hmm.
and you can't get around the numbers, right? Because people are dying.
Mm-hmm.
You can count the number of people that
Yep.
die, right? You
Yep.
can count the number of hospitalizations. You can count these cases. And to me, that it's no different than counting the cases of individuals who in the Black and Brown community that have hypertension. Because if you look at the hypertension and diabetes, it all lays out the same.
Yep.
So I feel like there's an opportunity now, right, to really say, yeah, we've been talking about this for a long time, but here are the numbers. They're affecting you and us. So what are we going to do different?
Mm-hmm.
So here's an opportunity to show up at the table with some hardcore information that somebody else in the dominant culture has created, and now
Mm-hmm.
you can't get away from it now. So
That's right.
now what? Now what do we do?
So,
Right?
so I think what you're speaking to is that the quote unquote establishment has been willing to disbelieve our voice and
Right.
disbelieve how we
Mm-hmm.
feel we are being impacted or ignored or marginalized. And they will paint that into something that they will say is simply a deficiency in us. It's our behavior or our ignorance or our
Mm-hmm.
unwillingness. But the whole thing is that they lay all of the maladies uh, at our doorstep without acknowledging their
Right.
systems, processes, power arrangements
Right.
put us in that position and keep us
Mm-hmm.
there and block our
Correct.
effort to serve
Right.
our own interest, even when us serving our own interest will help the state at large. They are comfortable keeping us in
Correct.
a situation
Mm-hmm.
of dependency and of lack. And so I think the COVID-19 crisis and the George Floyd crisis together make
Right.
a demand on society, not just here in Minnesota, but around the world, that we re-examine,
Right.
these relationships
Hmm.
because the disparities you just outlined, they exist across the board. Health, education, well, in health,
Right.
diabetes, hypertension, heart, all the other things, we index, uh, the wrong way in
Right.
all of those areas, and it's not because of us. We own some of that, but there are structures
Right.
and systems and processes and expectations and exclusions that facilitate
Hmm.
us being in that position, and
Right.
that's what the challenge is right now. How do we destroy structural
Right.
barriers to our health and wellness? And the
Hmm.
first structural barrier is uh, is removing the skepticism about our voice
Right.
and our
Right.
demand to be in control of our bodies, black bodies and brown bodies. We
Right.
got something to say about this. Yeah, I can go on, but
Right.
this is the conversation. And
Right.
Brenda, jump in the conversation.
Yeah.
Brenda, great, help me out here.
Yeah.
No, I'm okay. I'm taking care of my 73-year-old body. I might have a few mental problems from time to time, but Kimberly, how are you? And happy holidays and happy New Year's and all of that good stuff. We had the
Oh,
pleasure of
thank you.
interviewing Dr. Michael Brooks. Very impressive. So I enjoyed that. But you know, it's
Yes.
cold here. I'm in Santa Fe, New
Yes.
Mexico. But Al laughed at me. I said, I'm still walking. I'm in this small apartment, but I walk from one room to the
Oh.
other for 30 minutes so I can get it in.
Mm.
It's just
Yeah.
important.
Hmm.
And I have my breakfast, that's for sure. But you know, we do have to own some of it. Every time I watch Price is Right and I see some of us get up on the stage and you know we're like prone for heaviness, but some of it I think, you know, we can do something about. We can back off of the fried chicken
Hmm.
from time to time, not all the time.
Yeah. But I think this is just a COVID-19 has just kind of, to me, provides an opportunity to have a different type of conversation now than we've had in the past. Because, like Mr. McFarlane said, a lot of the things that have been happening to black and brown and indigenous folks for a long time, nobody wanted, just wanted to say, oh, that's because of you. But this virus wasn't anything that any of us created, right? Or sought on ourselves, but it has allowed some layers to be uncovered around how we provide healthcare and how people get information. It was very clear early on that people of color were going to be impacted. And so MDH, Hennepin County, all those folks who have to do public health and messaging were very specific about who they reached out to make sure that they could get messages out, right? And making sure that it was in the native languages and make sure it looked like the people who were being impacted and that we were in places where it mattered. Now, if we were doing that like 20 years ago, maybe we wouldn't be in this situation. But now the spotlight is on, and if you say you're about people and you want to keep everybody safe, then you're going to have to do things a little differently. And so the ability to get these messages out about wearing your mask, about social distancing, about all the symptoms and the changes in the symptoms for COVID-19 and all that has provided, I think, this window of opportunity to now say, well, what other messages should we be getting out, right? What other things should we be saying? And all of you corporate folks who say I'm about diversity and inclusion now, well, now you need to put your money where your mouth is, and let's really see, well, what are we going to do now? What are we going to do differently in ensuring that the voices of Black, Brown, and Indigenous people are heard, really heard, and then we move to some action. And so I'm excited about some of the opportunities that we have. COVID-19 has decimated a lot of families and communities, And I'm, really heartbroken about that. I've got family members in Texas now. Whole family is down, ill, and everybody's keeping their fingers crossed that nobody has to be hospitalized. And we've lost some folks this year around COVID. But in everything that happens, there's an opportunity, I feel, to do better. And so what are we learning now that we can do better and ensure that any other type of virus, pandemic, economic situation, educational setback, we as a people can find a way to keep going, because we've organized, right? And we've made our, positions known. Now what do we do together collectively to continue to move forward to ensure that we start to see a decrease in the incidence of diabetes and the incidence of hypertension and high school graduation rates going up and kids going to college, all in our economic situations as homeowners and building wealth, all those things start to change for people of color, because without us, you're not going to be able to do it.
Kimberly, I have a quick question, Al, if that's okay.
Yes.
Sure.
I wrote an article on Dr. Brooks, and he had mentioned that you have had student clinics at North High School, and that you work with one of the centers, I forgot the name of that, and others. But I was wondering, has North Point considered, after we get through the vaccination round and everything, of putting in more student clinics or putting in more health courses where we can start working with our young people about the importance of nutrition and exercise, since they have taken out physical education? I'm a former teacher, and I think that's one of the things I used to cringe with, was when my students would come in with a Coke and the hot Cheetos. And I'm saying, you're putting this on your stomach first thing in the morning, and you want to listen to what I have to teach you. But I was just wondering if North Point would consider expanding and really reaching our teens. And I know a real good place you can start. I'm so impressed with Tony's Cena's foundation and everything that he is doing. He is phenomenal. And that would be a good place to start with him. And
well, I would say that
Go ahead.
Yeah, I'm sorry, I didn't mean to interrupt.
No, that's okay.
I think we're always open to conversations about what we could be doing to support our young people. We've been in North High for, 40 plus years. And with this distance learning and not really knowing what the school district's next steps are.
Oh, yeah.
We would be partnering with them to figure out, well, what is the best next thing to do to support young people. We do have a couple of youth programs on the human services side. We work specifically with justice involved youth. And so we do infuse some of these health education and information into pro-social activities for them, but we could be doing a lot more. And so I think for us, Dr. Brooks is really good with the young people. His team works very well and did adjust during COVID to continue to provide these kind of screenings days for young people and their families to come in, because a lot of people were afraid to come, right? They thought, well, I'll come into a clinic, I might get COVID, I don't want to do that. And so we've gradually been able to get young people, these little kids, preschool and
well, it's a ways down the road, Kimberly. But it's
are working on our strategy with our school-based clinicians. We have some mental health providers in some of the schools to figure out, well, what can we be doing and how can we tie, our services that we do here to get them into the school. So I appreciate the suggestion. I'm going to be following up with Dr. Brooks and see the next time we come on if we have a plan.
Okay.
And Brenda, the likelihood is Tony's program is based in St. Paul in the community center.
Oh, that's true.
we're in North Minneapolis.
That's
There's a
true.
distance, but North Point does have relationships with major legacy institutions
Yeah.
right in the same physical neighborhood. Across the street from North Point is the Minneapolis Urban League
Yep.
headquarters, which has now become the Urban League of Twin Cities. So they've had historic engagements with the Urban League around social justice and health and jobs and training, et
Yeah.
cetera. And then there's another organization in the community, which is a historic settlement house called Phyllis Wheatley Community Center. And I know that North Point has been involved off and on with Phyllis Wheatley and other legacy leadership institutions. So I think North Point really is a standard bearer in accountability and engagement for the community, and and they're always inventing and reinventing ways to be involved. For me, Kimberly,
Mm-hmm.
the question is, the paper's role should be writing in ways that advocate to public policy decision makers the need to more fully fund uh, the work of North Point. I go back to this, and I've told this to your boss, Stella Whitney West. We've been partners. Insight News and
Mm-hmm.
North Point have been partners in the creation of the Insight to Health page in our newspaper, and also in the creation of the Insight to Health fitness challenge that we've had over several years quite successfely up until the COVID
Right.
disruption, which
Mm-hmm.
will resume beyond that. But I've said to Stella that growing up, my grandmother would tell me, boy, mind your business, and she would always talk about, because we were in a church family, the Lord's business is the biggest business on the planet. But she'd
Mm-hmm.
say it's church, but it's also business, right? So I take from that it's health, but it's also business. And we have to teach ourselves to mind our business.
Mm-hmm.
And our health is our business. And you
That's
can
true.
say that as a double entendre or triple entendre, but any way you say it, it's the right thing. We
Mm-hmm.
have to adopt this and embrace this idea that this is our business and we got to be responsible for minding that. I tell people that, like everybody else, I'm happy, I'm hopeful that at some point in time there'll be a pill I can take that would protect me
Yeah.
from cancer, a
Yeah.
cancer pill.
Exactly.
But between now and then, organizations like the Mayo Clinic in Rochester
Mm-hmm.
have marshaled millions and billions of dollars towards a solution. The revenue streams associated with problem solving are significant, and they create economies in and of themselves. What does that mean for North Minneapolis, where North Point is? Our neighborhood is ground zero for
Yes.
all of the health disparities
Mm-hmm.
people in America experience, making the health status of black Minnesotans in North Minneapolis the polar opposite to the general well-being that Minnesota boasts about as being one of the healthiest states in the country. It's
Mm-hmm.
healthiest except for the
Exactly.
black and the brown.
Mm-hmm.
That's us.
Mm-hmm.
So my long soliloquy ends with this. I propose to Stella that we have to figure out how to adopt this attitude in this process where we say our health is our business, and as opposed to being the worst place because
Right.
of these disparities, how do we chart our way to being the best
Best
place?
place. Right.
We're number one in Minnesota and number one in the country for a healthy, sustainable neighborhood. And that
Yeah.
sustainability includes health, it includes employment, it includes home ownership, it includes wealth, it includes entrepreneurship, it
Mm-hmm.
includes education, it includes art and culture and general livability. And
Mm-hmm.
I think you all are going to be the anchor of that. So that's Al McFarlane's sermon for today. you know,
Amen.
yeah.
That
But
was good. But I mean, I agree with you. I think sometimes we get distracted by other things. And one of the examples I use is Hennepin County's initiative around decreasing the teen pregnancy rate. Right? They picked one thing. They put a lot of resources, time, energy, and effort into that one thing for a long duration of time, and saw the decrease that they wanted to see.
Hmm.
right? And so we talk about all these disparities and we talk about them, right? But the type of energy, effort, resource, money, time to focus on one thing for a long duration of time, try things, it's just not there, right? It's not the shiny new thing. All right, we did that for 5 years, we're done. And then you bring it back the same thing 10 years later, instead of just sticking with this thing that we know will work because we've seen it work.
Hmm.
And so my hope is that we can get to that, having those kind of conversations with the county, with the city, with the feds, with whomever, say this is the disparity we want to focus on. North Point, we can focus on a lot of things. We applied to for some funding from a funder that funds a lot of things. They're like, you all are too big, you got too many things going on. We don't know if we can assist. And so for us, we want to be able to get to a place where we can talk about our stuff in a way that Mayo talks about their stuff. But that requires a heavy investment in infrastructure
Hmm.
and resources around research, development, all those things that, Mayo doesn't even think about now. And I'm hoping North Point can get to that.
Hmm.
We don't have to think about it. It just happens. The $1 million checks come and we're, focused on, childhood obesity or, decreasing the number of kids who have cavities and don't have cavities by the time they graduate from high school, whatever it might be. How do we follow our folks who stay in this community, right? We're a generational organization.
Hmm.
Most of the people who work here got their care here.
Hmm.
Their mama got their care here, their
Hmm.
daddy, their granddaddy, all of
Right.
that. And
Right.
so we have a richness of information
Hmm.
right here that we haven't necessarily tapped into because we don't get resourced in that way. Right? Yeah, I'll fund a program or I'll fund the food shelf. But I need you to fund some infrastructure,
Yeah.
some data collection, some public health programming, some things like that so that we can say, this is what our community looks like, and these are the improvements that we've made based on what we've done here in this corner, in our community, whatever it might be. How do we build this system like Mayo's system, right? They're everywhere. Rochester and Wisconsin, they're here.
Hmm.
Like, how do we build a North Point pilot city, whatever we want to call it, that permeates throughout Hennepin County, that we
Hmm.
can say we are the ones who are
Hmm.
making this happen and owning it for our community? Because our community board, I think, is the key to our ability to do some of the things that you talked about, to be trusted in the community, to be able to be innovative and change up when we need to. It's because our community board is saying, this is what I'm hearing. I need you all to figure out how to get this done. But you all didn't do that very well. I need you to go back and adjust and make sure that you do that well. Because for me, if I'm not doing something right, I need you to tell me so I
Yeah.
can correct it, right?
That's
So we can do something, so we can do better.
That's right.
Because when we all do better, we all do better. And so I'm excited by what you said, because now I'm going to be like, hey, Mr. McFarlane, I need. So I got you on speed dial now.
There we go. That's fine. Well, listen, Kimberly Spates, Chief Operations Officer for North Point Health and Wellness. It's been a pleasure talking with you today and listening and sharing at the same time. And I simply want to close by thanking you and thanking Stella Whitney West and Dr. Brooks and your entire team, including my daughter, Michelle Wells, who's
Yeah.
one of your managers on your team. I thank all of you for what you do and for being here. And I'm going to keep speaking into existence the power that will accrue to you to deliver value to our community and to our county. That unless we are serious about the investment required to
Yeah.
create that sustainability to unlock the genius of healing in our
Right.
people, then it will not happen. I predict and proclaim that it must happen and that you all will be the conduit for that to happen. So thank you so much.
Thank
Our
you.
regards to Brian Bergs too.
All right, I'll let him know. Thank you so much. Happy holidays. Happy New Year. Y'all stay
You
safe.
too.
Wear
And
your
stay
mask
safe.
6 feet away. Get tested if you need to. Thank you so much.
We're
Take
going
care.
to come back and talk about vaccinations too. That's the other thing.
Okay.
Before I do that, you know what? I would. I don't know what the plan is for vaccinations for this neighborhood,
Okay.
but I want to just put this out there. I would love to be one of the elders in the community and leaders in the community who does a public vaccination experience at North Point.
Okay. Okay.
I want my vaccination to come from North Point. And
Gotcha.
I want to figure out how I get a dozen or 2 dozen other of my colleagues in leadership to
Okay.
show up at the same time or virtually so that we can model our confidence in the science and encourage our people to step forward and be vaccinated. So let's talk about that down
All
the
right. Dr. Brooks is actually the head of our COVID-19 vaccination group. And so I'll be sure to set something up for us to talk about how the best way to make that happen. So I appreciate that.
Thank you so
Thank
much.
you. All right. Take care.
Bye
Have
bye.
a good